My name is Dr. Viola Morolo from Africa Urology, and today we'll be talking about circumcisions. So the starting point with regards to circumcisions is to discuss the parts of the body that circumcisions are being performed. And so I've got this model to demonstrate. So this is the penis, and this part of the penis is called the glans, which is normally people refer to as the head of the penis. And the foreskin, which is what the circumcision, works on or removes, is around the glans of the penis. And if I can just draw it for you, so you have a better picture of what I'm talking about. And I'm always told that my pictures are great, so I hope you also think the same. This is obviously an exaggeration. So this is the testes, and then that's the penis. And on top of the penis, the blanket of the penis, of the glans I should say, is the foreskin. So that there is actually the foreskin, and which is what we remove when we do the circumcision. So that's the penis, that's the penile head or the glans of the penis, and that's the foreskin. The next discussion point is, why do we conduct the circumcisions? What are the indications for circumcisions? So there are various indications, for example, religious reasons, cultural reasons, and I'll focus on the medical reasons because that's my area of expertise. And for children, for example, the reasons why a child would require circumcisions is if they have what we call a phimosis. And a phimosis is where you are unable to retract the foreskin down. Now, if the foreskin, and worst case scenario is where you have a paraphimosis, where the tip of the foreskin is so narrow that when you attempt to retract the foreskin, it actually constricts the penile head, the penile head, the glans, and then limits the blood supply, which can obviously result to necrosis of the penile head. Another reason to have for circumcision is, for example, for children who have recurrent urinary tract infections, even adults as well, that can circumcisions can be the treatment for recurrent urinary tract infections. For adults, one of the reasons that we conduct circumcisions is for penile cancer. So it can actually be a part of a cancer treatment depending on where the lesion is. And so that can also be one of the reasons for circumcisions. Now, if we talk about the benefits of circumcisions, one of the big benefits of circumcision is for the reduction of HIV. Now, we know that there has been research that has shown that circumcision can reduce the risk of HIV by 59%, almost 60%. Now, this doesn't mean that it prevents the transmission of HIV infection. It just reduces the risk by 59%, which means one would have to have other preventative strategies for HIV combined with the circumcision, but you would understand that reducing it by 59% is quite significant. Now, another benefit, as I mentioned, that with the circumcision, the foreskin is around the glans. Now, there's secretions that happen in the glans and in the skin, in the foreskin, and those secretions we call that smegma. Now, obviously, on a daily basis, one would have to clean that foreskin, the smegma, because then if you don't clean it, it accumulates and then it results in a foul smell. Now, if you've been circumcised, then you are easily able to clean the glans without the limitation of the foreskin having to be retracted every time to make sure that your glans is nice and clean without the smegma. So that would be the reason to also the benefits of circumcision for hygienic reasons. So let's talk about the procedure itself. It's a day procedure, and I normally do it in theater. And there's not much in terms of pre-op preparation that needs to be done. You just have to make sure that you're starved, which means you have to spend 6 hours not eating or drinking anything. Normally you are allowed to drink water 2 hours before, but we prefer our patients to be completely starved for 6 hours. You come to theater. The procedure itself takes about an hour. So 30 minutes for the surgical time, and then of course we have to set aside time for the anesthesia. And then post-op, we will monitor you for about an hour to make sure that you're fine. And if you're fine, you can go home. And the recovery is normally 3 to 5 days. And after 2 weeks, you should be 100% fine. The healing should have happened completely, and you should have a seamless wound that looks like you were born like that. Let us journey with you to maximize your health. Feel free to visit our rooms at Cure Hospital in Midstream, and we will support you through this journey.